5 factors that can contribute to pancreatic cancer. Pancreatic cancer is one of the most lethal forms of the disease and ranks among the most fatal types each year. It causes the death of more than 450,000 people worldwide and is among the 12 most common types of cancer. What worries experts is its progressive increase, growing by around 1% a year since the 1990s. Furthermore, after diagnosis, only 5% of patients survive for more than 5 years. In this article, we'll cover 5 factors that can lead to pancreatic cancer and essential information about this disease. How does pancreatic cancer develop? Pancreatic cancer occurs when the cells of this organ undergo abnormal mutations. The pancreas plays a key role in digestion, producing enzymes that help break down food and regulating blood sugar levels. Cell changes can be triggered by genetic factors, general health, diet, and lifestyle. These abnormal cells grow uncontrollably, forming tumors that can be benign or malignant. The most common type is pancreatic adenocarcinoma, which affects the ducts responsible for transporting digestive enzymes out of the pancreas. How long can you have pancreatic cancer without knowing? One of the main difficulties in diagnosing pancreatic cancer is the absence of symptoms in the early stages. Often, the disease is only identified when it has already spread to other parts of the body. Studies indicate that a person can live 10 to 20 years with cancer without realizing it. Researchers from the Autonomous University of Nuevo León in Mexico point out that only 10 to 20% of cases are diagnosed early. However, even when detected at an early stage, the 5-year survival rate remains low at around 5%. Pancreatic cancer progresses aggressively, although its evolution can take years without any obvious signs. Scientists from the University of Porto have created an experimental model of an artificial pancreas made of collagen to better understand the progression of the disease. The study showed that cancer cells attack healthy ones while they are still located in the organ, making the cancer particularly dangerous and difficult to detect. Influence of heredity on pancreatic cancer. Having a family history of the disease can increase the risk, but does not determine that someone will develop the cancer. Many people who have been diagnosed have no cases in their family. However, first-degree relatives, such as parents, siblings, or children, with a history of the disease increase the chances of manifestation. Specific genetic alterations can also contribute to the development of cancer. Although genetic predisposition is not a determining factor, those with a family history should undergo regular examinations to detect possible signs early on. Does coffee cause pancreatic cancer? Since the 1980s, various studies have been carried out to assess the relationship between coffee consumption and pancreatic cancer. However, the most recent studies indicate that the drink does not increase the risk of the disease. On the contrary, compounds present in coffee may have a protective effect, helping to combat cellular aging. Chinese experts in pancreatic surgery have analyzed various studies and suggest that coffee can help repair DNA, eliminate defective cells, and reduce harmful inflammatory processes. However, it is recommended to consume it in moderation and without excessive added sugar. Modifiable risk factors for pancreatic cancer. Some practices and habits can increase the chances of developing pancreatic cancer, but can be adjusted to reduce this risk. Smoking cigarettes and other tobacco products contain toxic substances that damage pancreatic cells. Approximately 25% of pancreatic cancer cases are linked to smoking. Overweight and obesity. Excess body fat can overload the pancreas and increase inflammation, raising the risk of the disease. Diabetes. Insulin resistance forces the pancreas to work excessively, which can lead to dangerous cell mutations. Chronic pancreatitis. Prolonged inflammation of the pancreas can be a trigger for the development of cancer. Maintaining a balanced diet and avoiding alcohol and cigarettes are effective preventative measures. Exposure to chemicals. Some industrial substances can increase the risk of pancreatic cancer. The use of protective equipment can minimize this exposure. Non-modifiable risk factors. Age. The risk of pancreatic cancer increases with advancing age, being more common after the age of 45. Gender. Men are more likely to develop this disease, although the reasons for this are not yet fully understood. Family history. People with close relatives diagnosed with pancreatic cancer have a higher risk of developing the disease. Genetic mutation and hereditary. Chronic pancreatitis. Some genetic alterations significantly increase the predisposition to pancreatic cancer. Possible risk factors still under study. Diet. Excessive consumption of processed meats, sugars, and refined carbohydrates may be linked to pancreatic cancer. Sedentary lifestyle, lack of physical activity can make it difficult to control glucose and overload the pancreas. Alcohol, excessive consumption of alcoholic drinks can cause inflammation in the organ. Infections, certain bacterial infections in the digestive system can contribute to the development of the disease. Warning signs of pancreatic cancer. Jaundice, yellowing skin and eyes can indicate blockages caused by pancreatic tumors. Itchy skin, the accumulation of bilirubin can cause intense itching. Changes in stools and urine, light, greasy stools and dark urine can be signs of the disease. Digestive problems, difficulty with digestion, bloating, and sudden weight loss may be related to pancreatic cancer. Pain in the abdomen or back, a tumor in the pancreas can cause persistent pain in these areas. Blood clots, patients with pancreatic cancer may be more prone to thrombosis. Sudden onset diabetes, cancer can interfere with insulin production, triggering diabetes unexpectedly. How can pancreatic cancer be prevented? Although it is not possible to completely avoid the disease, some measures can reduce the risks, such as avoiding smoking, maintaining a healthy weight, controlling diabetes, and adopting balanced eating habits. Regular medical consultations are essential to detect any changes early on. If you identify with any risk factors or symptoms, seek advice from a health professional. Like, subscribe to the channel, and share this information to help more people prevent themselves.